Hello students, this is Dr. Lubina Fathima, Senior Lecturer, Department of Public Health Dentistry, SRM Dental College and Hospital. Today I am going to take a topic on metabolization, estimation and mechanism of action of fluoride. So in my presentation I am going to discuss on these subheadings. Next moving on to metabolism of fluoride takes place by three processes. One is absorption, another one is distribution, followed by elimination. Absorption is the bioavailability of tropical fluoride. See, there are so many various type of tropical fluoride, which include sodium fluoride, stannous fluoride, acylated phosphate fluoride, dentrifies are the other types of fluoride. There's n number of types of fluoride. So all these types have a bioavailability close to 100%. Whereas a fluoride varnish, if you apply onto the tooth surface, it might last up to 12 hours, which will make your teeth free from caries lesion. Now next is absorption. So how does this fluoride absorb when you take it systemically? By two organs. One is lungs and another one is intestine. The maximum plasma concentration of fluoride on fasting stomach is reached in just 30 minutes. All the mechanism, all your fluoride which systemically acts may reach your stomach in 30. Now next is distribution of fluoride. Now how this fluoride gets distributed in your various areas of region. So first moving on to the soft tissue. Soft tissue 100 to 650 ppm of fluoride gets released. Okay. Now this is one of the very important one words might be asked in your final or university exam and also in your NEET question paper. Okay. So followed by fluoride in saliva is 0.07 to 0.05 ppm. Fluoride in enamel is 2200 to 3200 ppm. Fluoride in dentin is 200 to 300 ppm. Fluoride in cementum is 4500 ppm. Fluoride in dental plaque is 15 to 64 ppm. So which is the highest? They might ask in your one word question, which is the highest of fluoride which is present in your tooth means this cementum, which is 4500 ppm, followed by your enamel, which is 2000 to 3200 ppm. So these are the very repeated question, which is the highest of the tooth structure where the fluoride is present. So it is cementum. Okay. So next is excretion of fluoride. Now how is this fluoride getting excreted when you consume it systemically? One, it is first through urine, it gets excreted, followed by your sweat and feces. So 10 to 25% of the fluoride intake is not absorbed actually. It gets excreted in your feces. The renal clearance rate of fluoride ranges from 30 to 50 ml per minute. About 30% of fluoride is excreted in 6 hours. So remember these. Now the next three questions I am telling is very important for your Viva as well as for your NEET exam and final year one words. So about 30% of fluoride get excreted in just 6 hours of your consumption systemically. Your fluoride gets released in 6 hours. Now followed by when it converts into 60%, it takes nearly 24 hours of your 60% of the fluoride getting excreted in your urine or sweat or feces, whatever mode it is, but in 30% get excreted in 6 hours and 60% get excreted in 24 hours. Next is breast milk and saliva is 0.4 μm of fluoride is present, whereas sweat 0.067 to 0.5 ppm of fluoride is present. This may all be your Viva questions or one word questions. Estimation of fluoride. This might be asked in your Viva or one was not as a 5 mark. They'll just ask what are the ways of estimation of fluoride. There are only two ways of estimation. One is direct cannulization and other one is Carlson, creatine or Leshy device. Okay, these are the two ways of estimating the fluoride present. Now, how are you going to estimate the fluoride? Is when both the stimulated and unstimulated saliva are collected for analysis, the content of the saliva which you collect may vary with flow rate. So the stimulus used may be mechanical such as citric acid. The flow rate of saliva, what it does, it exhibits a circadian rhythm. So if the concentration of the fluoride in saliva are derived from systemic source, then you are going to get directly from the gall ducts. Okay. So these are the two methods where in this mode of transfer you are going to estimate. Now next moving to mechanism of action. This is a very important 5 mark which might be asked in a university question paper. So there are 5 mechanisms of action of fluoride. One is increase in enamel resistance. Second, increase in rate of post-eruptive maturation. Next comes the remineralization of incipient lesion. Next, interferes with microorganism. Fifth is the modification of tooth morphology. So I'll tell you one by one what does really the fluoride does. So for example, when you eat something, what happens when you don't gargle your mouth after your meal? Your bacteria, that bacteria will produce various types of acid, and that will make the tooth get surrounded by bacteria. So that time, if you apply this fluoride, it's going to retain all the lost minerals and make your teeth very strong. So that is the role of fluoride in short. Now I'll tell you in one. So increase in enamel resistance, here two process takes place. When your caries lesion is formed and when you apply the enamel, you are going to remineralization process takes place and reprecipitation takes place. Now what this fluoride does after the application is it reduces the bacterial acid production and acidurization. Next is reduces the equilibrium solubility of the apatite crystals. Next is the fluidation of apatite crystal surface reduces the dissolution rate. Second is increase the rate of post-eruptive maturation. Now how is this going to increase the post-eruptive maturation? See, when you are going to apply this on hypermineralized area, actually the tooth which is more prone to caries is your hypomineralized area when compared to a hypermineralized area. Okay. Now this fluoride, what it does it increases the rate of mineralization and post-eruptive maturation. Followed by this maturation will involve various minerals which will convert this hypomineralized area into hyper, and this demineralization involves deposition of minerals into demineralized area. This is what there will be an increase in the rate of post-eruptive. Next is remineralization of incipient lesion. What happens here is this dental caries is reduced by enhancing remineralization. See, when this process of remineralization takes place, your occurrence of the dental caries to that particular tooth reduces. So here the most effective remineralization solution is found in combination with calcium and phosphate. But now there are various new type of era where there is CCP, ACP, which is calcium, casein, phosphate, and so it is nothing but CPP, ACP, which stands for casein phosphopeptide amorphous calcium phosphate. Okay, so they are new interventions. Next, followed by this fluoride enhance the rate of mineralization from calcium phosphate solution. Now the fourth step is it interferes the microorganism. Yeah, obviously when there is a caries lesion, there will be microorganism also. So that time when you apply this fluoride, it's going to interfere with the microorganism present. In high concentration, fluoride is a bactericidal activity. Whereas in low concentration, fluoride is a bacteriostatic. Static means constant, whereas cidal is going to kill all the microorganisms. In vitro effects, these three play a very important role in vitro effects. Okay, in vitro effects it is enolase, bacterial phosphate, cation transport. Okay, next is the last step in your mechanism of action of fluoride is modification in tooth morphology. So here there is a direct relationship between the amount of fluoride injected during tooth development and the incidence of dental caries. So here the diameter and cusp depths of teeth are smaller if fluoride is present during a tooth development. So this is the reality of what happens to the modification of tooth morphology. So now let's revise. There are five a mechanism of action of fluoride. First is the increase in enamel resistance or reduction in enamel solubility. Second is increase in rate of post-eruptive maturation. Third is remineralization of incipient lesion. Fourth is interfere with plaque microorganism. Fifth is modification in tooth morphology. So this is one of the very important 5 mark. So what this fluoride really does is when you apply this fluoride onto a caries lesion, it's going to involve this 5 mechanism of action and make your teeth healthy and free from microorganism. The mechanism of action is when this hydroxyapatite goes deteriorates this fluoride onto applied, here it converts into fluoroapatite crystals, thereby making the teeth very strong. Now this is a quick revision of the mind map of my entire fluoride content. So we have seen three topics here: metabolism, estimation and mechanism of action. Metabolism, as I told you, it is absorption, distribution and elimination. So the elimination is, as you have told you, it's urine, feces, and absorption is lung and intestine. Distribution is all your what to say fluoride is going to get deposit in within 6 hours in your stomach. Estimation is how are you going to calculate the amount of fluoride present. So these are two types: Carlson cretin or Lashy device direct cannulization. Now mechanism of action, as I told you before, there are 5 steps: increase in enamel resistance, increase in rate of post-eruptive maturation, remineralization of incipient lesion, interferes with microorganism, modification in tooth morphology. So this is a quick revision of whatever topic I have told you today. Thank you students. I hope this presentation is very useful for you. Thank you.